Hi there, I'm Allison Perrin, one of the breast surgeons here at Northwest Hospital. This video has been created for patients that have undergone breast or axillary lymph node surgery in order to gain a better understanding of postoperative drain care and exercise in order to optimize the recovery process. First, let's start with the drain. Your drain is a soft tube placed under the skin during surgery to help collect blood and other fluid that accumulates after surgery. Most drains are kept in for 1 to 3 weeks after surgery, usually until the output is less than 30 milliliters per day. It's okay to lightly shower with your drain in, but don't soak in a tub or use a shower sprayer directed upwards toward your wound. You may also take a sponge bath if you prefer. If your gauze inside your dressing gets wet in the shower or from drainage, you will need to change the dressing with fresh gauze and waterproof tape. If you don't have waterproof tape available, use paper tape and then switch to sponge baths for cleaning. Now let's meet an expert who will go over optimal drain care.
Hello, I'm Ann. I'm from the Northwest Hospital nursing staff. Drains decrease the chance of infection and promote wound healing. Here's a few instructions for you to better care for your drain at home. First, wash your hands. Next, remove the plug from the pouring spout and pour drainage into a measuring cup. Compress the suction container and flatten and replace the plug into the spout. Keeping the container flat helps remove the drainage from under the skin. Record the date, time, and amount of drainage on the sheet provided. In addition, note any problems you might have encountered. Empty the container 2 or 3 times a day as directed by your surgeon, and remember to milk the tubing 1 to 2 times a day as needed if the tubing appears clogged. Make sure to report to your doctor if any of the following symptoms occur: redness or drainage around the drain site, inability to keep the drain compressed, or a fever of 100.5 degrees that lasts for more than 24 hours. If you have any questions or concerns, please don't hesitate to contact your doctor or your nurse.
Now it's time to get to postoperative exercises. Let's meet an expert who will go over these exercises in detail.
Hi, I'm Emily, and I'll be leading you through your recovery exercises. These exercises are designed to help you regain strength, flexibility, and movement after your surgery. These exercises are beneficial for improving circulation and decreasing swelling following surgery, and will minimize tightness across your chest and armpit as you heal. Your posture and breathing will be improved by lengthening the muscles in your chest. These lengthened muscles will allow you to take more full breaths, which will oxygenize and energize you and help to keep your shoulders in line with your body for a more upright posture. Following surgery, you may find moving uncomfortable, and you may not be able to do the full movements or full number of repetitions right away. However, do as much as you comfortably can. Movement will enhance your recovery, so it's important to start moving as soon as possible. If the pain continues, notify your doctor or nurse. All right, let's get started. Lie down and use pillows to support your arm and hand so that your hand is above the level of your heart. Squeeze the ball 15 to 20 times as you bend and straighten your elbow. This action will facilitate pumping of your blood to increase circulation and decrease swelling. Lie down with your knees bent and your feet flat. Place a pillow under your head if it makes you more comfortable. Bring your hands together and raise your arms straight up toward the ceiling. Hold this for 5 seconds and return to the starting position. If you're not able to bring your hands together, keep your hands at shoulder width distance apart. Lie down with your knees bent, feet flat, and hands behind your head. Now slowly lower your elbows down and away from each other. Hold this for 5 seconds and return to the starting position. If you're not able to reach behind your head, place your hands on your forehead. Try to inhale as you lengthen the muscles of your chest and lower your elbows. And then exhale as you come back to the center. Sit in front of a mirror if you have one available to you. Seated in a chair without resting on the back of the chair, your arms should be at your sides with your elbows bent. Gently squeeze your shoulder blades together, bringing your elbows behind you. Hold this for 5 seconds and return to the starting position. Make sure to keep your shoulders down so that you avoid causing undue stress to your upper back and your neck. This exercise will allow you to strengthen the muscles of your back to open the muscles in the front. This section covers exercises you should do after the first week. You should now be able to start bringing your hands above your shoulders. Lie on your back with your knees bent and feet flat. If it makes you more comfortable, place a pillow behind your head and make sure the pillow is lengthwise so not to impede your range of motion of your arms. Slowly raise your arms overhead, leading with your thumbs and keeping your elbows as straight as you can. Hold for 5 seconds and return to the starting position. Now, if you're unable to bring your palms together, go ahead and keep your arms at shoulder width distance apart. Lie on your back with your knees bent, feet flat, and arms comfortably at your sides. Keeping your knees together, slowly rotate your legs to the left. You should feel a diagonal stretch from your shoulder down to your knee. Hold 5 seconds and return to the starting position. Now rotate your knees to the right. Again, hold 5 seconds and return to the starting position. This exercise not only stretches the muscles of your chest, but also strengthens the muscles of your core, which are the muscles surrounding your spine. If you have a history of low back pain and this bothers your back, make the movement smaller or skip it altogether. Lie on your back with your knees bent, feet flat, and hands behind your head. Keeping your knees together, slowly rotate your legs to the left. Hold for 5 seconds and return to the starting position. Then rotate to the right, again holding 5 seconds and returning to the starting position. If you're not able to bring your hands behind your head, go ahead and place your hands on your forehead. Again, if you have a history of low back pain and this bothers your back, make the movement smaller or skip this exercise. Make sure to keep breathing as you move your knees. Sit up tall at the edge of a chair and bring your hands behind your head. Keeping your elbows back, slowly lean your trunk to the left by lifting your right elbow toward the sky. Hold for 5 seconds if you can, and then return to the starting position. Now bend to the right. Make sure not to collapse into your upper chest or your neck. Keep your elbow back and use the strength of your core to pull yourself back to the center. This exercise will allow you to bring in more oxygen by expanding the rib cage. So remember to bring your navel toward your spine and keep breathing. Sit up tall on a chair with a back and place a pillow in the small of your back. Now bring your hands up behind your head and slowly lean backwards. Use the weight of your head to carefully stretch up and back to open your chest. Inhale as you lean back. Exhale as you come back to the starting position. Sit up tall at the edge of a chair and clasp your hands together in front of you. Lift your arms up slowly overhead, straightening your arms. Keeping your arms overhead, bend your trunk to the left at the waist. Hold for 5 seconds, then return to the starting position. Now bend to the right. Make sure to keep breathing and engage your abdominal muscles to protect your lower back. Stand facing a wall with your toes 8 to 10 inches from the wall. Place both hands on the wall and use your fingers to climb the wall, reaching as high as you can until you feel a gentle stretch. Hold the stretch 5 seconds, trying not to arch your back. If you feel like you want a deeper stretch, turn sideways and slowly slide your hand up the wall. Remember, these exercises will help you to regain full movement and strength of your arm, maintain correct posture, and minimize tightness across your chest and armpit. Make sure you do them daily and contact your doctor should problems occur.
I hope you found this video to be helpful. Going through breast surgery can be very stressful, and all of us here at Northwest Hospital want your recovery to go as smoothly as possible. If you're having problems with any portion of your recovery process, please call your surgeon's office. Thank you, and best wishes for a speedy recovery.